In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Medical Taskforce for Combating Coronavirus, His Excellency Dr. Walid Al-Mana, Undersecretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamila Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now, as usual, we shall begin with Dr. Walid Al-Mana, Undersecretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within His knowledge. Praise be to Him for His countless blessings and grace. And praise be to the Prophet. We meet with you again in this press conference to update you on the most recent updates regarding dealing with COVID-19. Well, the press conference is going to be about 2 main topics. The first topic is about the updates regarding the booster dose and the updates regarding the traffic light in a manner that would contribute to safeguard the health and safety of everyone. And the second topic is about the importance of the booster dose in protecting the community. And in order to safeguard and maintain the achievements of the kingdom, and due to the increasing spread of Delta in many countries, in addition to the effectiveness of vaccination and booster doses in enhancing immunity and protecting the individuals and society from the complications of the virus, it has been announced following the approval of the Executive Committee to take the following in advance. The level yellow will be the minimum level for the traffic lights mechanism until we finish vaccinating 80% of those category 40 ages and above to complete the booster dose for those who qualify for this. And therefore, the yellow level will be implemented starting from next Sunday, 1st of August. And therefore, and until we achieve 80% of those 48 years old and above receiving the booster dose who are qualified for it, the average of the existing cases will be calculated by moving from the yellow, orange, and red only, according to the traffic light system mechanism. So, the traffic light, so there will not be any green level now. So only yellow, orange, and red in order to deal with the current circumstance. Well, of course, until we have 80% of those 40 years old and above receiving the booster dose. And to reduce the period for the booster dose to 1 month for those taking the Sinopharm. And this is for those aging 40 years old and above. And 31st of August, the yellow and Be Aware app will change to yellow automatically for those aging 40 years old and above in order to remind them to take the booster dose. And it will go to green after taking the booster dose. Therefore, we call upon all those who are 40 years old and above to register for taking the booster dose through Be Aware app or the Ministry of Health website, healthalert.gov.ph. When finishing vaccinating 80% of those 40 years old and above of the booster dose, then to decide from changing red, orange, yellow, or green after completing the 80% of those category will be according to the traffic light system. Then we'll go back to calculate according to the regular average. So please everyone, be strict to your appointments in order to enhance immunity and safeguard your health and safety and your family and relatives. And to conclude, we confirm that only with your collaboration we're all going to combat the virus and fully recovery and protect the health and safety of everyone. Now I'll leave the floor to Dr. Manaf Al-Qahtani. Please proceed. Thank you, Dr. Walid Al-Mana. In the name of God, most gracious, most merciful, good afternoon, everyone. Well, at the beginning, I'd like to refer to the decision announced now by Dr. Walid of moving from one level to another according to the continuous and ongoing assessment of the National Medical Taskforce, as we always mentioned in the press conferences. Because we have updates, we have to follow these updates and in order to protect the health and safety of the society. This decision taken by the Medical Task Force was based on protecting one of the dearest category for us by providing the booster dose to enhance their immunity. As you know, now 2 months and a half after the booster dose, and thank God, we have seen the positive results, the initial ones of using such vaccination, which enhances the immunity of the body with the variances of the virus. And we confirm that the Kingdom of Bahrain, thank God, is always keen on taking the precautionary measures and continuous with the vaccination campaign. And we refer that what has been mentioned in previous conferences to take the booster dose is for the health and safety of everyone. And this program of booster doses is based on comprehensive studies conducted in the Kingdom of Bahrain, and it was shared with some bodies and organizations, and we call upon citizens and residents to take this booster dose because we've seen by ourselves in the Kingdom of Bahrain the benefits of such booster dose in completing one of the categories of the society. And we note that this booster dose will enhance and accelerate the effectiveness of the vaccination and will put down and decrease the symptoms, and to complete all the doses on time in order to protect the health and safety of everyone. According to statistics, which are always fixed, they're always fixed, but the medical decisions are going to change because the virus is changing. So there is difference between science statistics and the medical decisions, which are in line with the changing of the virus. So let's differentiate between the science, statistics, and the decisions. And thank God the Kingdom of Bahrain has always been using studies in order to implement the precautionary measures against the virus. And let me share with you some statistics that shared by the Ministry of Health to support the booster dose. So far, up to Tuesday, 27th of July, we had 131,191 individuals who took the booster dose. And out of these people, only 71 cases got the virus 14 days after taking the virus, which is a very low percentage, which is like 0.05%. And those 71 cases did not need treatment nor the ICU, in which we have seen an increase in the number of the active cases. But there were some symptoms and the need for treatment, and there eventually to ICU, which could eventually lead to death. So I confirm no death cases were registered from this category which took the booster dose and did not need treatment nor admission into hospital after taking the booster dose. And this confirms on real hand, we have a proof that this booster dose protects the human from the virus and the variants. Well, to conclude, to combat the virus, it requires the collaboration of everyone together and to stay away from false allegations that could lead, without basing on any statistics or figures, and could destabilize the efforts of the national team since the beginning of the virus in order to enhance immunity and protect individuals in society. Now I'll leave the floor to Dr. Jamila Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. Please proceed. Thank you very much, Dr. Manaf Al-Qahtani. Peace be upon you. In the name of God, most gracious, most merciful, we welcome you again in this press conference through which Dr. Walid Al-Mani announced the decision to move to the yellow level until we complete vaccinating 80% of those 40 years old and above of the booster dose. Well, we confirmed that the Medical Task Force put the health and safety of everyone on priority by reviewing all the decisions and statistics and accordingly take the appropriate recommendations. And therefore, we note to support all these decisions by the Medical Task Force because it's for the health and safety of society. So it's important to thank all citizens and residents who took the vaccine and took the booster dose, through which they contributed to combating COVID-19. So we're here to call upon those who are 40 years old and above to collaborate with the concerned and register for the vaccine and to strictly follow their appointments in order to achieve the target. And we have seen with the numbers we've seen in the Kingdom of Bahrain, the results of taking the booster dose was successful, and it reduced the number of the active cases and protecting people from the variants and enhancing the community immunity. So it's important here to mention something very important. To reach the current, the current level does not mean like we're done with the virus. We warn people of this false sense of security and the consequences of this sense. So please always continue implementing the social distancing, taking the vaccines and the booster doses. So again, those who are 40 years old and above, please take the booster dose to enhance the social immunity, and we recommend Pfizer. So far, we have not registered any complications nor side effects with those taking the booster dose, and if they took it, they were really mild, as any other injections, like the redness in the injection spot, and which we can take the painkillers. And we don't need to listen to the rumors. And please listen and take the sources, take the information from the reliable sources, and take the vaccine and the booster dose to protect everyone. Well, we're talking based on statistics and based on active cases we're experiencing. And those who took the booster dose, if they got infected, it really helped them in reducing going to ICU and the death rates. And to conclude, we would like to call upon everyone to continue implementing all the precautionary measures, social distancing, taking the vaccines and the booster dose, and to collaborate with the people concerned in order to contribute to combat the virus. Thank you very much. Thank you very much, the speakers, for your briefs. Now we begin with taking the questions who are following us remotely. Question from Anba Al-Yom newspaper from Yara Nasser to Dr. Walid Al-Mana. While being recovered from the consequences of the virus and to maintain this recovery in Bahrain, is the vaccination going to be imposed on those coming to the Kingdom of Bahrain? And what for those who were proven to be active, like those who are in transit? Thank you for the question, Yara. First, to impose vaccines even in the Kingdom of Bahrain, we have never imposed the vaccine. It's optional. As for those arriving to Bahrain or like traveling from Bahrain, it could be one of the conditions, requirements. So far it's not a requirement. Since the beginning of the pandemic, the door is open for everyone, and we put the conditions according to the indicators and statistics. Is this open on the floor, on the table? We look at the problem and the impact of people, coming to Bahrain or leaving Bahrain. So if we reached a level, just to give you an example, sometimes some diseases, like they were spread in the world and they had vaccines, then it became a condition for a country. Those arriving to a country will be vaccinated, because some vaccines are really important in order not to spread it in the country, and each country has the right to do so. And now we're talking about COVID. It is still spreading around the world, and the percentage of vaccines are still low. Thank God, we in the Kingdom of Bahrain, we have a high percentage of vaccines, like 70% of the population, whether residents and citizens. But other countries, they don't have such. So Bahrain have to cope for the internal interest. So we take this into consideration. The second question, for those who are, got infected through in transit, they don't get the test until they are coming to Bahrain, entering Bahrain. Some airlines, they put the condition that they have to take the PCR test, while those coming from the red list of those countries, they have to take the PCR before coming to the airport. But if they are proven to be infected, they have to be like quarantined, isolated, and whether they need to go to hospital or not. And we'll put all the precautionary measures as usual. Thank you. Question from Huda Abdul Hamid, Al-Watan newspaper, to Dr. Manaf Al-Qahtani. Some citizens and residents are not categorized like part of the elderly, and they have chronic diseases, and they are looking for taking the booster dose because they want to enhance their immunity, or maybe because they're going outside Bahrain, maybe those students going to study abroad. So are you going to give them exceptions to get the booster dose now? Excellent. That's a good question. I think maybe over the 18 months we experienced with the decisions, I think it's time now to announce that our decisions, what we call data-driven policy or risk and data-driven policy, it is based on statistics. So we don't have exceptions for those people who wish, because there are so many people like they want to take booster doses, but they were rejected because our medical decisions are based on scientific studies and facts. They don't change. So we don't have exceptions to those, for taking booster dose. We have mentioned before that the booster dose program started in the Kingdom of Bahrain based on a special category that we sensed the risk on them, and we felt and saw that those, with the 50 years old and above were like they having the more rate of death. That's why we allocated them. So just to summarize, we don't have exceptions because we are basing our decisions on statistics and facts. Question from Tamam Busafi to Al-Ayam newspaper to Dr. Jamila Salman. We are about to have Ashura season. Are we going to maintain the green level during this rituals? And are there any specific procedures that will be coordinated with MATEMs in order to reduce the active cases? Thank you for the question. Well, this is going to be with the traffic system based on the statistics in order to take the decision. And as we mentioned previously, even during Eid, the traffic light system is not applicable to occasions, whether religious or social. And we are in continuous coordination with the Supreme Council of Islamic Affairs on this. Question from Sidraj from Star Vision newspaper to Dr. Walid Al-Mana. The WHO Director General praised the experience of the Kingdom of Bahrain in combating COVID-19. Now, after lifting these tricks, there is a possibility of having an increase in the active cases. So what are the steps taken to maintain this? Thank you for the question. Well, maybe lifting these restrictions is not right. So what happened, we put the traffic light system, the levels, and we shared it with society. So whenever the assessment leads to green or yellow or any other one, we will implement them with the existing precautionary measures. So we have a clear way. So it's not hidden to anyone. And we have one fixed path. So if we're moving from one level to another, it's not about, to release restrictions or no, because the measures are always there, but based on the activities that we shared with society so they are aware and they commit to the decisions. And based on that, we reach, thank God, to green level. And now like we're announcing the yellow, but going now to yellow for something important, because the importance of maintaining lives of people and the lives of our people, which could lead to death. So we've seen based on statistics that the booster dose has great positive impact on reducing the complications and the death rates on those people with that category from 40 years old and above. So by focusing on this, we've seen space for them in the levels. So do we have precautions? Yes, they are there according to the levels. Most importantly, the continuous assessment of the medical task force, and to look into any indicators and facts that could be for the benefit of everyone. So we decide based on the indicators, on the statistics, to change from one level to another, and may God help us so we can go back to normal life. Well, by now we conclude the conference. Thank you very much for the speakers, for their briefs, and for answering the questions, and also for the journalists who are following us remotely, and for you, ladies and gentlemen. And before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Thank you all.